Hi folks, this is a video about an upcoming podcast episode I'm going to be publishing in a couple of days. I interviewed a nutritionist. Her name is Justine Stenger, and she practices out of a clinic in Calgary, Alberta. So another another Canadian, not a local Canadian, I'm in Nova Scotia, but another Canadian anyways. And we just finished having a really great chat about phospholipids. So phosphatidylcholine, phosphatidylethaноlamide, phosphatidylinositol, phosphatidylserine, and just basically how those phospholipids are incredibly important for our overall cellular health, our mitochondrial health, which of course, as I've mentioned in many of my other videos, mitochondrial health is incredibly important for overall cellular health. Mitochondrial health is really at the root of any chronic disease entity that you can possibly think of, so really, really important. And one of the things that I'm really excited about now that we've just finished our interview is the approach that she's using and the products that she's using to help with the phospholipid needs of a patient's body are really quite unique. As I mentioned in the interview, I've been relatively underwhelmed with the effects of different phospholipids. I've seen a few conditions, like certain liver conditions, where some phosphatidylcholine supplements and analogous supplements have been helpful, but for the most part, they haven't really worked the way that they should work on paper for me. But as she was saying, there's quite a lot of difference between the sort of nature and quality of the different products that are available for phospholipid supplements. And so after our conversation, I'm very excited and motivated to take another run at phospholipid replacement therapy, as it is sometimes called. She also mentioned some lab testing that was not something that I was aware of, and so to kind of assess for the needs for these types of supplements as well. So always nice when we can have an objective metric to give us some insight into whether this is something that a patient actually needs. So I'm quite motivated to take another foray into the wild, wacky world of phospholipids. As she was saying in the interview, it's been I'm paraphrasing here a little bit, or don't mean to put words in her mouth, but I believe she said that it's essentially one of the most, if not the most important thing that's been the most important supplement, the most important nutraceutical that has made just a really, really huge difference in her practice. She works out of a clinic that specializes in treating patients dealing with complex chronic health issues. So it's not like, she's just running a standard nutrition practice, seeing people with a little bit of adrenal fatigue, a little bit of IBS. Not that those are necessarily easy things to treat, but just where she's steeped in patients that are similar to the patients that I work with, dealing with complex chronic illness. She's saying she was working with a lot of patients dealing with mast cell activation syndrome, which is such an important condition to be aware of and to treat when it's afoot. It can be underpin a lot of the folks who are really, really sensitive and react really easily to various supplements and foods and things like that. So it's a really great conversation. I really encourage you to listen to it, listen to our interview, or watch it if you want to watch it on YouTube. I post all of my podcast episodes on all the major podcast platforms. Again, it's called the Overcoming Chronic Illness Podcast, if you're not already familiar. And then I also post all the videos on my YouTube channel. So if you're watching this on Facebook or Instagram or Twitter or some other place, please check out the YouTube channel. It's YouTube channel is called Halifax Naturopathic Doctor, or just search for my name, Brian Raid, and I have all the podcast episodes uploaded onto there. So if you yourself have had any experience working with phospholipids, phospholipid replacement therapy, whether it's intravenous phospholipids, oral phospholipids, whatever it happens to be, and you don't mind sharing some of your experience in the comment section, please let us know. Were they helpful? Were they not helpful? If they were helpful, what kind of things did they help with? Do they cause flare-up issues? So if you're comfortable sharing some information about that, I know folks enjoy reading the comments and kind of getting feedback from folks on the ground who are actually working with these things. And if you have any questions or comments about any other topics related to complex chronic health issues, please feel free to post in the comment section below, and I'll do my best to answer as soon as I can.